So there are several ways that managed services can benefit healthcare IT. One of them is security and making sure everything is not only up to date in regards to security or new threats that are coming out, but also HIPAA compliance. That's a big one. Another way is also in terms of the uptime of the servers or the infrastructure. A lot of times things can happen and you don't have time to wait around, especially when it comes to like patients or distributing medication or things like that. You're not going to need something that's going to be down for a day or 2 days or a week or et cetera, et cetera. You're going to need something that is extremely reliable and has a consistent high uptime. Another way is also, in my opinion, agility. I've noticed that MSPs are significantly more agile and they can pivot faster, and that's because they're used to dealing with such a high volume and high pressure environments like healthcare IT. It also is extremely cost effective because it gives you a predictable model for the financial officers, like CFOs, so they can know exactly what to budget when it comes to their healthcare IT costs. They don't have these inflated costs that are coming from internal IT, so it's a more predictable financial model. Another one I really like, I think is very important, is 24-hour support. MSPs are notorious for operating around the clock. Again, that goes back to agility. So if anything happens, they're probably going to get a notification and they're probably going to know before you will. But if you call them, you can basically call them at any hour of the day or the evening and they're going to get right on it. You're not going to have to wait on, people's schedules or working around their schedules, because a lot of times in healthcare that people work long hours or after hours. So those are some of the benefits that it can bring to healthcare.